Hi, it's Dr. Greg Jantz. As a counselor and founder of the Center, a place of hope. We do believe there is hope. And there is something called, and I've written on it, it's in a couple of my books, dependent personality disorder. I just want to explain this briefly. This is oftentimes referred to as DPD. And it's when a person's condition becomes so emotionally over-reliant on others to meet their needs, to do things for them, to validate them, give them constant reassurance. So that's dependent personality disorder. Sometimes you're going to see the codependency. The book I wrote with Dr. Tim Clinton is Am I Codependent?, which is all about developing dependent personality disorder. What is it? It's one of the recognized personality disorders in our Diagnostic and Statistical Manual of Disorders, and that's version 5. We usually say just DSM-5. And it's characterized by a chronic psychological need to be taken care of. Think about that. A chronic psychological need to be taken care of. People with DPD, they struggle often just to function independently, or they feel hopeless when they're alone. Here are some of the key symptoms. Difficulty making decisions without lots and lots of reassurance. Lots and lots of reassurance. The fear of abandonment. People with DPD, dependent personality disorder, go to great lengths to avoid disapproval, avoid conflict. They're just really afraid of abandonment. So if you disapprove me, you're abandoning me, betrayal, and I'm terribly afraid of abandonment if I have a dependent personality disorder. I want to avoid responsibility is number 3. Preferring others to take charge of all major areas of my life, like finances, work, medical, you name it. And I'm also going to struggle with low self-esteem. I really do have the belief that I can't function alone. And finally, there's overcompliance. I may put other people's needs first, even when it's harmful or it's unhealthy for them. Putting other people's needs first, even when it's harmful or unhealthy for them. That's that overcompliance. So what is the causes, the contributing factors? Well, there's usually early childhood experiences that were traumatic. You could have had really overbearing or overprotective, probably authoritarian parenting. It could be cultural or family expectations. The family expectations or the family environment that really discourages independence and can reinforce dependent patterns. There's the biological, that's number 3, biological and personality factors. There's a natural temperament that you're born with. You see this early on in a baby. And anxiety tendency, you may see that early on. And so if that's not redirected, reassured early on, that person you start to see anxiety in childhood. And there's that dependent personality forming. Okay, how does this affect our relationships? Well, have you heard the word cleanliness? This is the person, they're clinging on to you. This strains relationships. It just sucks the life out of you. There's the constant need for reassurance, and this really can overwhelm loved ones. There's the risk of being taken advantage of. I may stay as a dependent personality in a toxic or abusive relationship to avoid being alone. I may have a lack of boundaries. I may have difficulty asserting needs that leads to resentment or burnout in others. All right, what do we do? Well, there's cognitive behavioral therapy. There's what we call talk therapy. We do need to rebuild and get to some core issues so we can rebuild a sense of self and self-esteem. So that means dealing with trauma is important. We do see people in our different groups, particularly on trauma, really who have had a dependent personality disorder really benefit from that, because we're talking about some childhood experiences that built layers of trauma. All right. We do believe in the whole person approach. That's what the Center of Place of Hope is all about. So we're going to cover faith, spiritual, if a person desires that. We're going to also obviously look at family history. We want to look at body chemistry, nutrition, exercise, relationships. We're going to look at everything that could have went into that to create that dependent personality disorder. And it does affect us, affects them, of course, and the well-being of every relationship. We can see, and I write about it in the book, Am I Dependent? Because you will see a person, it's exhilarating in one word, as you start to make these changes, because the fear, the anxiety kind of peaks for a bit, until there's stabilization, and you really do see a person, I can be confident in myself, and then you see them begin to transform. That's what we do here at the Center, A Place of Hope.